As summer winds down and temperatures get cooler, we all notice a change in our skin tone and appearance. That bit of tan fades, and in its place, dark spots and blotchy skin. Makeup can cover some of these spots, but there's a permanent solution. Dr. Therese Stubbs from Therese Aesthetic Medicine joins me. Dr. Ann, nice to see you.
Good to see you again, too.
You know, we do love the sun because we get so little of it here in Central Ohio. But especially as we age, I notice it myself, this discoloration of the skin once that tan fades.
Right.
What's that caused from? The sun?
Well, UVB rays. So there's UVA and UVB rays in sunlight. And so the UVB rays are what tan us, but also as we age, we tend to get an uneven tan, or basically some age spots. So we get brown spots, we get blotchy, and that tends to come a little bit more with age. The UVA ray is a longer wavelength. That's one that goes through windows, it goes through windshields, and that's the one that damages your collagen. It makes the skin sag a little bit. So sun's bad for us in two ways, but it does feel good once it hits here in June. So.
You know, that's funny that you say that, because the ones that I've noticed on my own face are from where I drive, that side of the window. I never would have thought about that.
Yes, we have a lot of women come in at the end of the summer and they say, I've got the brown spots right along my jawline, and a lot of times it's right where the sun comes through the window.
So what can we do?
There are lots of different options, but we're going to talk today a little bit about peels. And I think a lot of people come in and they say, I really don't understand what a peel is. And a peel is basically just taking the top couple layers off of the skin. So the epidermis, or the top layer, you always have new skin cells coming up, so we take off the top couple layers. So you can do a little bit, or you can do a little bit deeper, so you can choose different elements: a mechanical peel, a chemical peel, a laser peel. Basically, laser peels are deeper usually, and they're accompanied by a lot of heat. Heat tightens the skin, and I think we're seeing right now a laser peel. That's an IPL, or intense pulse light, and then we peel right over the top of it. So it basically takes the brown spots right off.
Do you go and specifically look for brown spots, or do you do the whole face?
We do the whole face because that creates a little more of an even texture. It basically evens out the skin tone everywhere. Even the areas without brown tend to get the pores smaller and just a nice brighter finish.
And this is a before and after, and the results in this are dramatic.
This is a chemical peel. This is one of our most popular chemical peels right now. It takes off the first couple layers of skin, and it tightens the skin too. Interestingly, this chemical peel, it's called a VI peel, has a little bit of phenol in it. And phenol is a numbing agent, so it doesn't hurt at all, and it also tightens the skin. And it can just take care of things like acne scars too, and just some of the browns that come along with acne.
Is a chemical peel deeper than a laser, or just does it depend on how you use them?
Exactly. You can do a 10 micron, which is a very low laser peel, or if someone's looking for a bigger result and maybe can afford a little more downtime, we can go up to a 60 or an 80 micron laser peel. So I can choose the depth with the laser. Chemicals, you can't choose the depth as well with chemicals. So usually it's just the combination of chemicals and knowing how deep that's going to permeate into the skin.
How do you know which type then is best for each person?
And that's going to depend on a couple things. We usually do a consultation with people first and see what they're looking for and how much downtime they can afford. A lot of times there's some of the newer chemical peels, you're only red or flaky for a day or two. We kind of call those the weekend peels. And then if somebody's got, say, they've got a big wedding coming up and they really want their skin to look fresh and vibrant, we just go for a little more of a deep peel, and we might be having 4 or 5 days of redness in some peel.
Okay, so it's mostly redness that you're experiencing when you say downtime?
Yes, and the day right after any peel, whether it's chemical, whether it's laser, you're going to be a little bit red, and then usually there's some flaking thereafter.
This is an amazing one, too. These before and afters are always so shocking to me.
Right, the pigment's gone, and it kind of evens out some of the fine lines and wrinkles, too, because if you think about it, it's just taking off the top level of those little mountains of wrinkles. These are laser peel results that you're seeing right here. Those are micro peel. So differing depths and differing downtimes, and that's something that we kind of counsel patients individually on. How much time do you have, and what are you looking for as a final result?
And pain, discomfort with either the chemical or the laser?
Both of these are very comfortable. We've gotten to the point in medicine where especially if we're doing something cosmetic, we try very hard not to make it ever uncomfortable. The VI
because they're coming in on their own.
Exactly. This is the thing we're choosing to do. But basically, you feel a little tingling, and that's about it. And we use some topical numbing cream for the laser peel as well. Well,
to veer on to one more thing, you're also having a party coming up, and you want to invite all of our daytime viewers. A Dress for Success charity type thing.
It is. We always have twice a year we have a big cocktail party for all of our patients to come in and kind of learn about things, and we're sponsoring Dress for Success this year. So we're asking people to bring gently used pumps, pearls, or purses, and they will get a $100 gift certificate to spend on any of our services or even just a facial.
What a great deal. That's November 17th. So mark it on your calendar. Come and see you and have a great time and benefit Dress for Success.
Thank you.
Thanks, Dr. Ann.